Hi, I'm Dr. Rahi Victory, the Medical Director at Victory Reproductive Care, and we really want to thank you for agreeing to be an egg donor for our program and helping to build families along with us hand in hand. So today I want to briefly give you kind of a who's who and a where's where of what's going to happen along the path of you being an egg donor with Victory Reproductive Care. So this is a really simple, elegant process. There's a couple of steps along the way. I'll point all of those out for you, and hopefully this will help answer some of the questions you may have. Step one. The first step is simply doing a screening session with us. We're going to ask you questions about your personal history, about your family history, your medical history, your social habits, and get to know you better to make sure that at least on the ground level, you qualify for all the things that we need to make sure are in place to make you an excellent donor for our program. Step two, we need to test you. The testing is basically a urine test and a blood test or series of blood tests for us to get to know a little bit more about your hormone levels, your sexually transmitted disease screen, a drug test, and genetic testing to make sure that you are genetically appropriate for whoever is providing us with sperm. The third part of this is for us to actually spend some time and go through all of the results that we get and make sure that you are a good match for our intended parents. So for example, if you are a carrier for cystic fibrosis and the intended parent is a carrier for cystic fibrosis, that may prevent us from using you as a donor because together you could have about a 25% chance of producing embryos that actually have cystic fibrosis, and that's something we need to avoid where possible. So we spend a lot of time getting those results that you've done and matching them and making sure that everything is perfect before we proceed with getting you ready for your donation. Some of the features of the tests that we will be doing for you are things like checking how strong your ovaries are, as I mentioned, the drug test, the sexually transmitted disease screen, and then of course the genetic testing. Altogether, you're probably going to be spending about a month to 6 weeks getting those tests done and then having us analyze the results and process them and make sure that you're a good match. The next step is going through the actual stimulation process. So now that you're ready to go, we're going to reach out to you and do a teaching session. Our teaching session is always a one-on-one video session with a nurse and yourself, and we also have additional links to videos we've already done on how to use the medications as you go through the process, because you will be using injectable medications to help stimulate your egg production, and everybody needs to know exactly how to use those medications and when. So we are going to give you the links. You'll be able to see them right up there, and on top of that you will be able to access our own staff at any point in time that you need, so we can go through the specific steps with you. The second part of that, and as part of that initial video chat, we will give you a schedule where we will explain to you exactly when and how you will start the medications and what the rough schedule is of when you will be on the various medications. It's really important for you to know that we cannot predict your biology with certainty. In general, we expect our patients to take somewhere between 9 to 11 days of the injections, and then after that, it's about a 36-hour wait till you show up for your retrieval. But there are some patients that are ready a day or so earlier, and there are some patients that take a day or two later. My one request from all of you is don't plan anything for at least 2 weeks from the time that you start your shots, to make sure that you give us an ample opportunity to get your eggs to grow, develop, have you come here, do your retrieval, and have a chance to recover before you're planning any special events, engagements, other activities, especially anything that requires you be away or be physically active in any significant degree. Once you have started the process of your stimulation, you'll be going in for several blood tests and ultrasounds, usually anywhere from 3 to 5 times, for us to make sure your eggs are growing and that they've reached the right stage. Once they've reached the right stage, we're now going to give you what's called a trigger shot, which is comprised of 2 medications to help make sure that you release the maximum number of mature eggs possible. It's really important you pay attention to what time we tell you to take that shot, because that's what determines what time your retrieval will be. If there are any questions, always reach out. Super critical to get that part right. Once you come into VRC, we're going to bring you in, do lots of name checks, identification checks, and make sure that we've got the right donor for our patients. Once we're confirmed that it's you and you're the right donor at that day, we're then going to proceed with getting an IV ready for you, doing updated checklists, getting updated information from you, and a quick physical exam so that we can be compliant with Health Canada regulations. Once we've done all of that, we'll take you into the OR, and we have a very strong reputation for making sure that we keep you extremely comfortable during the procedure. So we will give you enough medications through the IV that you gently fall asleep, and we will be able to do the egg retrieval procedure without any discomfort or hopefully sensation for you at all. If at any point in time you are uncomfortable, we always stop. We wait until you're more comfortable and then we proceed. We will never continue if you are not comfortable. And that's my promise to you, no matter who you are or what stage of the process you're in. The last part of this is what happens after the retrieval. So following the retrieval, we will keep you here for an hour or two, make sure you're comfortable. There will be medications we want you to take to get your ovaries to shut back down again and go back to normal as quickly as possible. And you'll take those usually for about 10 days to 2 weeks after the retrieval process. It is normal to expect some degree of bloating and discomfort, but you should never have severe symptoms of unbearable pain, severe bloating where your belly is really getting blown up, fever or chills or anything else unusual like that. As a note, you may notice that your first period after an egg retrieval is heavy, and that's because we've created a lot of estrogen in your body, and some of that estrogen will still be circulating around, making the lining of your uterus be a little bit thick. So if your first period's a little heavier than normal, expect that to be the case. It will go right back to normal afterwards. If at any point in time during your process you have questions, absolutely feel free to reach out to our amazing nursing team and make sure that they respond to you, or you can get a hold of me directly. It's really important to us to have open dialogue and have full transparency with everything that we're doing so that this journey is as smooth, effective, efficient, and comfortable for you as possible. If there's anything that's confusing, just reach out and say, hey, I'm not sure I know what's going on here, or I need some questions answered, and we will always get back to you as quickly as possible. Thank you again for being such an integral and important part of Victory Reproductive Care's third-party program. We really look forward to working with you, and I will make sure that this journey is a good one for you.